Hello friends, good evening. I am Dr. Avnish Goel, a senior consultant dermatologist and aesthetic laser surgeon. Having post-MD clinical experience of over 15 years, I am an educator and orator in dermatology, sexually transmitted diseases, lasers and various aesthetic procedures. I have more than 25 publications in my name. I do have a vast clinical experience. You can connect me in my Telegram group. The name of the group is Dermatology by Dr. Avnish, and the link to that group is dermatology underscore for underscore NEET PG. My referral code for Unacademy platform, it is 10 Dharma, and for YouTube it is Dr. Avnish YT. So these are my referral code. In case you wish to join the Unacademy, you can use this code to get additional 10% discount. So let us start with few announcements. So Unacademy has introduced the iconic subscription. So that subscription includes the subscription of the Unacademy, wherein you will get the live, you can attend the live classes and batch courses, live test and quizzes, and the best of prep letter in the form of recorded rapid revision courses and the question bank. Now the charges for the iconic subscription for a year, it is around 49,500 rupees. It is inclusive of 10% discount. And to avail that discount, you can punch in the code DRAvnish-YT. For the plus subscription for a year, the charges are 24,750 rupees, again inclusive of 10% discount. And again, to get the discount, you can punch in the code DRAvnish-YT. Also on Unacademy, it's going on a T20 series for NEET PG 2022 at 9 p.m. So you will be asked a mixed bags of MCQ related to pertaining to all the topics. So 20 MCQs will be asked daily. So you can join it. You can see your performance. And for NEET PG 2021, it is going on at 8 p.m. Now coming to the topic in proper, so let us discuss 6 MCQs on sexually transmitted disease in dermatology. So this is the part 1 of it. So these MCQs these are the PYQs, the previous year questions of various examination, let it be of 2020, 2019, 18 and 17. So this is your first question. So the question was taken from AIMS May 2017. So the lady that she presented with greenish frothy discharge associated with vaginal itching, and on examination the strawberry cervix was present. So the diagnosis will be the Trichomonas vaginitis, and the treatment in such scenario will be with metronidazole. So the treatment will be with metronidazole. So the correct answer is the choice B. So the answer, you can see in the image the greenish color of the discharge, the frothy nature of the discharge, and when it is associated with severe pruritus, it goes in the favor of Trichomonas vaginitis, and the Trichomonas, it is an protozoa. So it is a protozoa which causes the vaginitis. It is active during menses. It can be due to fomites, and the treatment is with the metronidazole. Yes, Gaurav, you are absolutely right with the answer. So Trichomonas vaginitis, it is caused by a protozoa. The name of the protozoa is Trichomonas vaginalis. The protozoa is active during menses. The source of contact could be sexual contact, or it could be due to fomites as well. Now the nature of discharge, the discharge is greenish yellow and frothy. Now this greenish yellow color, it is due to liberation of myeloperoxidases, and it is associated with severe itching. Now the color of the color of the cervix is strawberry cervix. It is also called as colpitis macularis, and the treatment is with metronidazole. So this is about the Trichomonas vaginitis. So this is the flagellate protozoa, the Trichomonas vaginalis. This is how you see in a hanging drop preparation. or the wet mount. Then this is the nature of the discharge. You can see the frothy nature of the discharge, greenish yellow discharge, and this is the strawberry spots on the cervix, which are very much characteristic of the trichomoniasis. Coming to question number 2, it was taken from INICET November 2020, and you can have multiple true answers in this question. So this question says the patient had painful ulcers over the glans penis. So the conditions which can give rise to the painful ulcers in this question could be the Haemophilus ducreae and herpes simplex. So chlamydia, it can cause LGV. So LGV can also cause the ulceration over the glans penis, but the ulcers will be painless. And the Neisseria, you know, it is associated with urethritis. So yes, Gaurav, you are absolutely right with your answer. The answer A and B both are the correct statement, correct answer for the given question. Because the painful ulcers over the genitalia, it is seen in the chancroid, it is seen in the herpes simplex. Otherwise, painless ulcers in the genitalia, that can be seen in LGV in the primary stage, that can be seen in syphilis, and that can be seen in donovanosis. So the painful ulcers will be in chancroid and herpes simplex. So this is the correct answer for the given question. Coming to question number 3. Again, it is taken from INICET. You can see multiple true answers in such question. So this is regarding chancroid. The following statements are true regarding chancroid. So for the given question, the school of fish appearance in the smear, yes, it is true. This is the true statement. Painful ulcers, yes, this is a true statement. It may bleed on touch. This is also a true statement. The ulcer which may bleed on touch, you can get it in donovanosis. You can get it in chancroid. And the groove sign, it is also a true statement because groove sign can be seen in LGV, it can be seen in chancroid as well. So all the 4 statements, they are true regarding chancroid. So the correct answer is all the 4 statements, they are true regarding the soft chancre or the chancroid. So let us have a look on what is chancroid. So chancroid is also called a soft chancre, soft sore, or ulcus molle. So in the chancre, hard chancre, it is the name given to the syphilis, and the soft chancre, it is the name given to the chancroid. The etiology of chancroid, it is Haemophilus ducreae. It requires factor 10 for its growth. Incubation period is small, it is 3 to 10 days. Then about the ulcers. So ulcers of chancroid, they are extremely painful, they are soft, they are friable, they have undermined margins, and they may bleed on touch. So this is a characteristic statement regarding the ulcer of chancroid. They are painful, soft, friable with undermined margins, and they may bleed on touch. Then few peculiarities of the lymph node enlargement of chancroid. So lymph node, they are called as bubos. So bubos of chancroid, they are again painful, but they are unilateral. So they are always unilateral, and when they suppurate, they form a single sinus. So these are the few peculiarities of the lymph node enlargement of the chancroid. So the lymph nodes, they are again painful, but they are strictly unilateral, and when they suppurate, they form single sinus. So this is the school of fish or railroad track appearance of the, what you can see the appearance in a smear examination of chancroid. Then these are the chancroidal ulcers. You can see the ulcers, they are soft, they are friable, they have the undermined edges, and they may bleed on touch. So extremely painful ulcers, they are seen in chancroid. So they can be seen in over the male genitalia, they can be seen in the females as well, multiple painful ulcers. So these are the lymph node enlargement in chancroid. They are strictly unilateral, they are never bilateral, they are strictly unilateral, and when they suppurate, they have single sinus. So they form single sinus when they suppurate. So this is what you can see when the bubo of chancroid, it suppurates. So how to make the diagnosis of chancroid? To make the diagnosis, you can do a smear examination in which you will see the school of fish or red roll track appearance. You can do an intradermal test. You can do an intradermal test that is called as Ito-Rin-Starina test, that becomes positive after second week. And if you do a biopsy from the edge of the ulcer, you will see the features of vasculitis. So these are the few important tests you can do in chancroid. So this is the school of fish or railroad track appearance. And this is an image of showing the vasculitis. That is what you can expect in a biopsy from the edge of the ulcer. So this is the groove sign of Greenblat. So that can be seen in chancroid as well, though it is quite characteristic of LGV. So groove sign of Greenblat can be seen in chancroid as well. So this is the enlargement of the inguinal and femoral lymph nodes along the two sides of inguinal ligament. It can be seen in chancroid as well. So regarding the buboes you can see in LGV, you can see it in chancroid. So in both the conditions, lymph node enlargement are called as buboes. So in LGV, by the time the patient presents, the ulceration may not be there. So usually the LGV may not have ulcers, but in the primary stage, the initial stage of LGV, you can have painless ulcers. While in chancroid, with the lymph node enlargement, ulcerations are always present. So the LGV buboes, they are less painful. Chancroidal buboes, they are more painful. In LGV, the lymph nodes can be bilateral in 1/3 of the patients, while in chancroid, it is always unilateral. Matting of lymph nodes can be present in LGV, while it is absent in chancroid. Groove sign is a feature of LGV, but can be present in chancroid as well. The LGV lymph nodes, they are multilocular, they open with the multiple sinuses, while chancroidal lymph nodes, they are unilocular and they open with the single sinus. So these are the differences between the buboes, the lymph nodes of chancroid and the LGV. So let us continue with few more announcements. You can download the Unacademy learning app from your Play Store. You can choose your goal as NEET PG. Then you can choose the subscription either from the iconic subscription or the plus subscription. Then for the time period you want, and you can punch in the code, like for if you want my code Dr. Avnish-YT to get 10% off. To continue further, my upcoming classes in December 2020, both the free special classes on Unacademy platform, on YouTube sessions. It will be previous year questions of the 2020, 2019, 2018 and 2017 of STDs and leprosy. Apart from it, I'll be doing MCQs of INI-CET, which was conducted in November 2020. I'll be doing the MCQs of FMGE, which was conducted in December 2020 and August 2020, and PYQs of NEET PG. So these are my upcoming classes. You can join the Unacademy and you can attend those free sessions there also. And to unlock the Unacademy free plan, you can use the code 10DERMA so that you can join all the free special classes on Unacademy. Now coming to question number 4, which is again taken from INI-CET November 2020. So yes, Gaurav, you are absolutely right. These are gram-negative diplococci. So these are gram-negative diplococci which you see in gonorrhea. You see them in gonorrhea. Pund cells or the Greenblat Pund cells you see in donovanosis. Henderson-Peterson bodies, they are intracytoplasmic inclusion bodies. They are seen in molluscum contagiosum, and multinucleated giant cells. They are characteristic of herpes infection. So what you are seeing in the image, it is a large mononuclear cell, and that mononuclear cell has got the diplococci inside them. So this is a feature of gonorrhea or Neisseria gonorrhea. So the Neisseria gonorrhea, the cause of the gonorrhea, it the correct answer is the choice D. So the Neisseria gonorrhea, it affects only columnar epithelium, cuboidal epithelium, or immature epithelium. It will never affect stratified squamous epithelia. It is the organism, it is gram negative, it is intracellular within the polymorphonuclear cells. It has got reniform arrangements, that is the parallel sites, they are opposite to each other, and incubation period of gonorrhea, it is the shortest among all the STDs. It may vary 1 day to 5 days or 2 days to 5 days. So in males, it causes that can be anterior urethritis, wherein you get the dysuria, the urethral discharge, and posterior urethritis, wherein you get the urgency and frequency of micturition. In addition, it can cause the proctitis when the anal intercourse is practiced, and pharyngitis when the oral intercourse is practiced. So these are the various type manifestations of gonorrhea in males. In females, most of the time it is asymptomatic, but it can cause cervicitis in extreme cases, and of course the urethritis. So these are the manifestations in female. The gonorrhea, it is a diplococci. It has got the parallel ends, they are opposite to each other. It has got hair-like structure on its surface, and these structures are called as pili. So these pili, they are organ of attachment, they are organ of invasion, and they are also the target of host immune response. So it has got the hair-like structures called as the pili. So this is the smear image of a Neisseria gonorrhea. So you can see diplococci which are there in the polymorphonuclear cells, and this is an imaginary picture to show that it is a diplococci. It has got pili on its surface. So this is the manifestation of gonorrhea in males. So it causes the purulent discharge, the urethritis. Similarly, it can cause the same in extreme cases in females. To diagnose, there is no specific serological test. You can make a smear. How to make the smear? You ask the patient to hold urine for 4 hours, then milk the urethra. What you will see in gram smear, a polymorph, the macrophage containing gram-negative diplococci. So you will see gram-negative diplococci within the polymorph in the smear, and there will be more than 5 pus cells or the polymorphs per oil immersion field. So this is the smear examination of gonococcal urethritis. You will see the diplococci within the polymorphs. And for the treatment of gonorrhea, for every case of gonorrhea, suspected gonorrhea, you have to treat non-gonococcal urethritis in addition. So for gonorrhea, you have to treat the non-gonococcal urethritis in addition. That is why the treatment is called as dual therapy. So for gonorrhea, you use injection ceftriaxone 250 mg IM stat or tablet cefixime 400 mg stat tablet. In addition, you have to give azithromycin 1 gram single dose for non-gonococcal urethritis or doxycycline 100 mg BD for 7 days for non-gonococcal urethritis. For every suspected case of gonorrhea, you have to treat the non-gonococcal urethritis in addition. About the other cells, the Pund cells. So Pund cells, they are also called as the Greenblat and Pund cells. So they are a feature of donovanosis. So again, it is a large mononuclear cell, a large macrophage. The nucleus is pushed towards the periphery, and you can see intracytoplasmic inclusion bodies, and these intracytoplasmic inclusion bodies have got a safety pin appearance. So safety pin appearance of intracytoplasmic inclusion bodies, it is seen, and the safety pin appearance, it is of the Klebsiella granulomatis, the causative organism of donovanosis. And Henderson-Peterson bodies, you know, it is the intracytoplasmic inclusion bodies. They are seen in Molluscum contagiosum. So these are restricted to epidermis. They are intracytoplasmic inclusion bodies seen in Molluscum contagiosum. Question number 5. So all of you have given the correct answer, Gaurav, Dr. Veer Malladayakar. So yes, this is, you are getting painful genital eruptions, and these are characteristic feature of genital herpes, and you get the grouped vesicles on a red base, which is a feature of genital herpes, and the painful genital ulcerations, they are the eruptions, they are characteristic of it. And you can do a Tzanck smear for the as a simple bedside investigation. But I want you to know that what you will see in the Tzanck smear in a case of genital herpes. So you will see two things in the genital herpes. You will see the Tzanck cells, and you will see multinucleated giant cells. So both of the things will be there in genital herpes, the Tzanck cells and the multinucleated giant cells. So I'll be clearing it more. So answer, yes, of course, it is the answer is choice A, the Tzanck smear. So this is the what you see in the smear of a genital herpes. You will see the acantholytic cells or the Tzanck cells, wherein you get the large nuclei with peripheral condensation of cytoplasms, and you will see multinucleated giant cells in addition. So both of the things will be a feature of the Tzanck smear in genital herpes. So the Tzanck smear, the scraping is done from the floor of the ulcer, and it is to demonstrate the Tzanck cells or acantholytic cells. So these cells, they are seen characteristically in pemphigus group of disorders, in Hailey-Hailey disease, staphylococcal scalded skin syndrome, can be seen in various viral infections like herpes simplex, varicella zoster infections. But in these two conditions, in addition to the Tzanck cells, you will see multinucleated giant cells also. So stains used are Giemsa, methylene blue, and dried stains. So for any herpes infections, you will, so this is the difference between the Tzanck cells and multinucleated giant cells. So Tzanck cells, they have the large nucleus and peripheral condensation of cytoplasms, while the multinucleated giant cells, it is a degeneration seen in herpes infections. So you will see the cells, the multiple cells, they join together, the cells, they are multinucleated in the herpes infections. So this is the Tzanck smear of a herpes infection. So you will see the giant cells, multinucleated giant cells, and the Tzanck cells. So both of them, they can be seen in herpes infections. While in case of pemphigus, you will see only the acantholytic cells or Tzanck cells. And in bullous pemphigoid, if you make a smear, you will see the eosinophil. So please be very clear that in herpes, you will see two things together, the Tzanck cells and the multinucleated giant cells. Both of them, they can occur together in any herpes infections, while in pemphigus you will see only acantholytic or the Tzanck cells. So to conclude, pemphigus you will see the acantholytic cells or the Tzanck cells. In herpetic infections you will see multinucleated giant cells in addition to the acantholytic cells. In skin tumors, you can see atypical cells, like in basal cell carcinoma, you can see the basiloid cells. In squamous cell carcinoma, you can see atypical keratinocytes. In malignant melanoma, you can see atypical melanocytes. So these are multiple other uses of Tzanck smear in dermatology, but mainly it is used for the pemphigus group of disorders or herpetic infections, while there is a long list of conditions wherein you can use the Tzanck smear as a simple bedside test. Question number 6. It was taken from FMGE May 2018. Yes, the shown penile condition. Yes, Dr. Veermala and Dr. Gaurav, you both are correct. It is Pearly penile papule. So these are not the warts, they are not the sebaceous gland hyperplasia, they are Pearly penile papule. So these are angiofibromas. These are the angiofibromas. They occur in rows of 1 to 3 rows of such angiofibromas, and they help in giving the sexual pleasure during intercourse. So the answer is choice B. So they are acral angiofibromas that are seen around the coronal sulcus. There can be multiple rows of it, 1 to several rows of flesh colored, smooth, dome shaped bumps, dome shaped elevations, and they contribute to sexual pleasure and quicker orgasms during sexual intercourse. So this was all which I had to present in today's class. So I urge you to attend more free live classes, plus courses and batch courses. You can use the referral code Dr. Avnish-YT to get 10% off. You can follow us on YouTube, Unacademy Live NEET PG. On Telegram, it is Unacademy NEET PG Live. And I personally will be very happy to answer your queries if there are any. And finally, I say thank you very much for your patient listening. It was nice interacting with you all. Have a good evening and thank you for watching.